Start?
Yeah.
Okay. Yeah, I think it's fine. Okay, good morning again. And welcome to the Mythology of Hope, Mythology and Autism session. Since all the lectures in this panel are interconnected, we will leave time for questions at the end of the session. Our first speakers are Shachar Ben Yehuda, a PhD student in special education at Bar-Ilan University. He has a BA in education and comparative literature and an MA in management, planning and policy making in education from the Hebrew University of Jerusalem, and an MA in special education, autism spectrum disorder specialization from Bar-Ilan University. He's also a graduate of the Mandel School of Educational Leadership. Shachar is the National Autism Counselor of the Israeli Ministry of Education. He is also a lecturer and a pedagogical educator in the special education program of Levinsky College of Education in Tel Aviv. Ayelet Pe'er, Dr. Ayelet Pe'er, teaches at the Bar-Ilan University Department of Classical Studies. Her research areas include civil wars in the Greco-Roman world and reception of the classical world in pop culture. Ayelet and Shachar will talk about myth and autism, the power of emotions. Please.
I'll just adjust our PowerPoint. Oh, I forgot to show a screen. Yeah. Sure. So sorry about lack of efficiency. Yeah, we have a sound. Okay, sorry. Okay, share sound. Okay, can everyone? Oh, I hope they can hear. They can see us and they can hear us. So, thank you. What? Yeah. So thank you everyone for the organizers of the Israeli Society for the Promotion of Classical Studies for inviting us to present, to give the background for the project, which Lisa and Susan will later discuss in full. And our panel discusses the interesting connection between mythology and autism, and our colleagues will take you through the very specific and wonderful journey of the different projects here and in the UK. And we will just give the background and the basis once these projects first originated. Now, Greek mythology offers us a plethora of likely and unlikely heroes, not to mention not likable and questionable heroes. So most of them are a far cry from our modern image of heroes and heroism, or especially superheroes, as Bar previously showed us, shaped by centuries of folktale and comics. The ancient hero, the mythological hero, is a flawed character. Sometimes he is or she is an outcast or an underdog. And this is why we specifically chose them as the heroes or the points of reference for our project on myth and autism. As will Shachar soon explained, there are more, these characters can be more identified or easy to identify with for autistic children. So without further ado, let us begin with the journey into the autism disorder.
Okay, so what does autism got to do with the Greek mythology, or actually any kind of mythology? So I hope that our panel today, Ayelet and mine, will reflect some of the partnership that we had during the past 2 years, I think. Okay, because I will explain and introduce you with autism, but Ayelet will interrupt from time to time, right? And we will discuss the connection between mythology and autism. So, in generally speaking, autism is a neurodevelopmental disability, okay, that has many kind or several characteristics that I would like to introduce you with, okay. The first one is that autism is an invisible disability. Why do I even try to explain this? Because our project in our project we involved children with autism in that are learning in regular settings, regular schools, okay, regular education, and most of them are learning with typically developing children, okay, and their disability is not visible to the typically developing children. And by that I mean that unlike a Down syndrome or hearing or sight impairments, okay, that you can actually see, okay, in a person with disability, you cannot actually see the autism in a child, okay, unless of course he's saying or referring to.
And I think this invisible disability is also what also allows us to connect this disorder with our mythological heroes. Now, I want to say we do not imply that the Greek mythological heroes were autistic. However, we do like to emphasize certain traits of autism which may be found in the mythological heroes, and the fact that it is an invisible disability really helps us, make this maybe weird diagnostic about the mythological heroes. For example, Susan later can say that Hercules shows maybe signs of autism himself. Why? We cannot see it in him. However, the way he acts or the way he reacts to things can also make us help us make this connection.
And in some cases, they're very confusing because you cannot see it, okay? Another character is, character is that we're talking about the cognitive spectrum. On the same spectrum, we have a lower functioning, that's what we call it, classic autism, and of course, cognitively able children with autism. And why do I say this? Again, because we're talking about, in our project, there were involved children that are cognitively able, okay, to understand and participate, okay, in social interactions with another kid, which hasn't got, of course, a disability. And this is very important for you to understand the project in whole. So in the same spectrum, we have children that are that have intellectual disability, and we have children which are cognitively able. And our project was, we worked with cognitively able children. Before the American Psychiatric Association decided in 2013 that autism will be now called ASD, Autism Spectrum Disorder, it used to be called PDD, which is Pervasive Developmental Disorder. And actually, autism is still a PDD, a pervasive developmental disorder, because many of the kids that we work with had a delay, let's say a critic or a major delay in their development, okay, as kids or infants, okay? And some of the delays are still, how would I say that, it's still vivid, okay, for us as therapists and teachers during the adolescence. So, most of the kids that we work with had, of course, pervasive developmental disorder. Functioning gaps is totally connected with the PDD, okay? Because some of the kids that we work with, they are they're like prodigies in mathematics, physics, mostly in this kind of areas. But some of them cannot ride a bus or shop in a store, or even tie their shoelaces. For children without disability, and in some cases for teachers in the education system, it's really hard for them to understand how a child can solve a very challenging mathematical issue, okay, in class, okay, but cannot tie his shoelaces. So this kind of extremes lives in the same child, and we have to face with it. And I think this also got to do with mythological, right?
Yes, because some children are fixated on heroes or superheroes or video games which are related to specific superheroes, and they can tell you everything from the history, like the Mercury character, for example, they can tell us all the history of the Flash characters, but then again, they cannot do something every day, okay, or something basic. So this is also why the mythology projects can fit in well with some of these children.
Well, let's talk about prevalence. Unfortunately, not unfortunately, the truth is that it's very manly, okay? In autism, we have for each 4 boys, we have 1 girl, okay? 1 one girl. So it's a very manly disorder. So the kids that we work with, the class that we work with, was composed with 8 boys, adolescents. It was a disaster. No, I'm kidding. But it was very challenging because boys are boys, okay? Even if they have autism or not. We will speak, probably you will speak about it later.
Which also takes us back to Greek mythology, where the main heroic characters are boys. Of every Perseus or Theseus or Achilles, you have one Atalanta. So also the identification of our audience, of our autistic children, is enlarged because they have many male figures they can identify with. And for the one autistic child, we have also the female figure.
And if we're talking about prevalence, we're talking about a ratio of 1 to 60 births. Okay, this is an American ratio. In Israel, it's something like 1 to 100. But the meaning of it for you is that we have an increasement, like major increasement in the amount of children that we are facing with in the Ministry of Education system. Sorry, that's my other job, my other occupation. But we have more and more students with autism in the education system, and we will speak about it later because this is about this is regarding to the project. Comorbidity, it sounds very bad. I don't like this term, but this is the professional term. It means that each child with autism, that autism does not come alone, okay? It always comes with another thing, usually learning disability, psychiatric disability, sometimes hearing or impairment disability, hearing or sight impairment. And it means that the children with autism, deal with both of them simultaneously. Okay, so I would like to speak about the ASD diagnostic criteria, not because I want you to tomorrow morning to be able to evaluate, children with autism in your surroundings, but to maybe to make more connections between ASD and mythological heroes. We have 2 main categories for us in order for me to evaluate or to assess a child with autism. We have 2 main categories. The first one is social affect. It's regarding the social communicational abilities of a child with autism, and it has 3 different subcategories. Deficits in social communication. I will speak about it in a minute, okay? Deficit in non-verbal communication, I will also speak about it later, and deficit in maintaining and understanding relationship with others. Okay, the first subcategory inside of the social communication arena, okay, or category, is that they have a lot of trouble. Children with autism have a lot of trouble to maintain reciprocity, emotional and social reciprocity. It means that when they interact with others, some of the times they're not even interested with the others. Okay, they have their own world, their own life. They are not interested in the others, or that they do not know how to do it. A usual common Israeli maybe small talk during the morning is, how are you? I'm okay. How are your children? I'm fine. How are your children? It's like what I called a conversational ping pong, okay, game. I answer, I ask you, you answer, you ask me, I answer. It's normal. The kids that we are working with are not doing this on a normal base. Well, they can answer us if we ask them, how are you today? They will answer most of the time, right? But in some of the cases, they will not even try to ask us, how do we feel? Okay.
So I think when Shachar told me about this criteria, I thought about, for example, Achilles and Agamemnon, that none of them is really interested in the other one's feelings because they are too preoccupied with their own inner emotions and distraught and jealousy and stuff like that. So again, I'm not saying that the Achilles was autistic, but he was certainly not too sensitive to the emotions of others, which led to this kind of escalation during his relationship with others and with Agamemnon especially, and also to all kinds of problems during the war. So this is the kind of thing that we would like to show you a bit of a taste of how it feels to be an autistic and how one can relate it to a completely mythological character.
And it's not rudeness. I'm not sure about Achilles because I don't know him, of course, but it's not rudeness. It's one of their features, okay? That's the way they are built, okay? And you have to face with it. Thank you. Non-verbal communicative behaviors, it's very, we use gestures, of course, facial expressions, okay, body movements in order to demonstrate to others how much we get information from others, and we present ourselves to others using gestures and facial expressions and etc. First of all, they do not understand other people's gestures, okay? In Hebrew, this signal is for you to wait just a second, okay? They do not, it's totally social, probably in the countries where you come from, it's not even a sign that you use in the street, or if you use it, you're gonna get, you know, in much trouble, okay? So it's very social, you learn it from a young age. First of all, they do not acknowledge gestures and facial expressions, and the second thing is they do not express themselves, okay? They do not know how to express feelings, etc. And this was the main thing that we worked with them, and I think, Lisa, you're going to speak about it later, so I'm not going to be talking about it too much. And we didn't find nonverbal communication problems in mythology, right? We didn't find, okay.
It was hard for me to find a character with a nonverbal.
Okay. The third subcategory in the social affect category is the deficit in developing and maintaining and understanding relationships. It's all about the connections with other, getting friendships, getting others to be your friend, joining a group, okay? This kind of social rules that we all, well, okay, most of us follow, I hope so, and they do not know how to follow because we set the rules, okay? We set the rules and we say to everybody how to you know, how they should act.
And I think in here, there are not too many mythological stories which are aimed at friendship, real friendship, being part of a group. Maybe the Argonauts, but we see also in the Argonauts story how it is difficult because every one of these heroes is his or her own individual, and sometimes they have a problem merging all of these very powerful and egoistical individual into one group. So it also made us think about how to enhance friendship in these stories and adapt them for the children. For example, Bellerophon and Pegasus, we tweaked it a bit, twitched the story in order to make the friendship the main theme of these stories, because Greek mythology is not about, you know, real friendship and warmth in most cases.
Less. Okay, the second category is a restricted, what we call RRB, restrictive repetitive behaviors, okay? In here, we have 4 subcategories. I will just do it very briefly because it might be tiring a little bit. We have repetitive motor movements and or the use of objects, but I mean in a very OCD kind of way, okay? And it's very stereotyped, okay? They do it in their own way. It's not normative, okay? Or what we call socially normative. Okay, should I, okay. And the second thing is that they insist on the same routines and the same rituals, okay? We all have, let me tell you something, we all have rituals, okay? But we wouldn't like to talk about it, but we wake up in the morning, we do the same thing, okay? We like our coffee in the exact same way we like our coffee, okay? And other things that we do during the day, okay? So people with autism are are much the same like us. The only thing is that they have a lot of trouble in getting back to the same position after something goes wrong. Well, I wanted to come here early today, so I did what I could, but I had a traffic, okay, jam in the way, and the guy in the security didn't let me in, and then I couldn't find a parking place, and I came here very, you know, frustrated. But it took me like 2-3 minutes, and I got back to myself. Children with autism have a lot of trouble in getting back to themselves, okay? to continue? Okay. The third thing, and I think you're going to speak about it, it's the highly restricted fixated interest. Well, it's hard for me to speak about this in this kind of audience because you all have highly restricted fixated interest that most of the people in Israel or most people in the world are not you don't share the common ground with other people, okay? Or you have a very narrow, I'm sorry, I'm kidding. Most of people do not think about Greek mythology during the day, okay? Let's put it that way. And should I leave? I'm kidding. No.
This is why we didn't have let a security guard let him in, so it's all planned.
Now I understand. Okay. People with autism take it to extremes, okay? North Korea can be a very interesting topic if you are 9 years old, okay, in regular school in Israel. Unfortunately, the other kids in class do not share the same values, okay? And so he is not the most welcome kid in class. And we had many examples of this, right, in our class.
And actually, again, if we take the mythological lens here, for example, if we look at Greek tragedies, for example, we see that the character is very, very obsessive regarding special interest. Of course, this is not exactly like the kid who is interested in North Korea, but for example, Antigone is all fixated about the burial of a brother. Of course, she has her own reasons and the religious reasons and political, etc. But this is all she thinks about. This is all she talks about. And when she talks to Ismene, for example, it's like they're talking together, but each one of them is in her own special and specific world. And Antigone does not let it go until the end. For example, another example is Oedipus, of course, who is adamant in solving the problem, who is the reason, who is the origin for the plague. And even when Tiresias is telling him, you are the murderer, it's you, it doesn't let go of his inquiry. All he cares about is his own inquiry of uncovering the truth, even if people are around him trying to deter him from it or even give him the answer, he doesn't mind, because all he cares about is finding the truth. He's so obsessed within this line of questioning, with his own research or own I don't know, investigation, thank you, that he's completely oblivious to anything else. So this can again allude to what an autistic child in class, because he wants to play with the specific video game now, even during our mythology lesson. And we try to tell him, no, but you can do it later. No, he will finish it and then he will rejoin the mythology lesson.
That's totally autistic. Okay, the fourth is the hyperreactivity to sensory integration. Okay, to sensory input. Sorry. So most of them will avoid any kind of sensory overload, or in some cases they need more sensory integration. Okay, they need more stimuli. You're not speaking about it, right? So
no, I just think we don't have time.
Yeah, unfortunately.
We move to the last slide to.
So we tried to. I think we tried to establish our relationship right here. Yeah. Okay. So, but okay. What did you want to make? What kind of progress did we want to make in the classroom? Well, we were speaking with the kids about narratives, about emotions. Okay, and we're talking about children that has a lot of problem in expressing emotion or understanding emotions of others. Okay, and actually a fellow research from IDC, the Interdisciplinary College in Herzliya, had made a wonderful, and I recommend you reading it, article and research about autobiographical memory. Autobiographical memory is a storage, okay? It's the way we store our own feelings and emotions and reflections of past events, okay? Things that we experienced in the past. And she tested it with adults with autism, and what she found out that they prefer the fictional autobiographical memory, and instead of their own personal self-autobiographical memory, they tell themselves, okay, the narrative that they tell themselves, okay, is different. It's not really, sometimes it's not connected to the reality, okay, and it's more like fictional.
This is where the mythological heroes also play an important part, because they have their own fictional narrative with which the children can identify or discuss in a way.
And what we have learned during the years that superheroes, fiction characters, well, if you would go with me to any kind of school that has children with autism class, okay, what we call communication class in Israel, you would find a lot of admiring for fiction characters and superheroes and Avengers and I don't know. They talk about it. They look for it. It's kind of their world. And
I think we should.
No, just a second. And what we know, that the narratives of mythological heroes and superheroes are effective tool, okay, for us to work with, okay, with children with autism, because it allows us allows them to express their own feelings and intentions and etc.
As Lisa
we'll probably speak about later.
This is just an overall view of what.
We're just
in a preference, in a preview.
Just a preview, like in Netflix. Okay, it's like a preview of what you're going to speak about. We had a social inclusion program for cognitive able students with autism in general class that are studying in a general school, regular school, in a general education class. Okay, and we were aiming to understand and to make them understand and practice pro-social emotions, and I think you're going to speak about it, so I don't want to speak about it. Social rules, problem-solving strategies, and of course, to get to know break mythology.
Thank you.
Thank you very much.
Okay.
So thanks. Thank you for a very interesting lecture. Very new to me. And we move on to the second speaker, our next